Chapter 1. The Hands That Heal. The operating room was cold. It was always cold. The residents still noticed, shifting their feet beneath their gowns, rubbing their fingers together when they thought no one was looking, and breathing into their masks before the surgery began. Andrew Grant never did. After 20 years in the operating room, his body had learned to regard discomfort as irrelevant. The room could be cold, the lights could be too bright, his back could ache, his stomach could be empty. None of it mattered. What mattered was the eye beneath the microscope. What mattered was the hand holding the instrument. What mattered was the next move. When Andrew entered an operating room, something in the room changed. It wasn't dramatic. No one stopped talking. No one announced him. There was no need. A resident straightened. A nurse checked the tray again, more carefully this time, as if it mattered more than it did 60 seconds ago. The anesthesiologist glanced at the monitors and then at Andrew, as if the numbers had acquired a different significance simply because he was there to read them. Andrew never acknowledged any of this. He didn't have to. For years, people had mistaken his silence for confidence, his restraint for discipline, his distance for professionalism. They weren't entirely wrong. Andrew had simply become very good at making absence look like control. To the hospital, he was the standard. His name appeared in conversations as a kind of punctuation. Grant doesn't do it that way. Watch Grant. That's how Grant handles it. He had built a reputation that no longer belonged entirely to him. It lived in the hands of residents who had trained beneath him, and the expectations of the nurses who had worked beside him for years, and the quiet relief that passed through a room whenever he said, "I got it." He had never not healed the eyesight of a single patient on the table. Not once. That fact had followed him for so long it had stopped feeling like an achievement and become something closer to a law. People trusted laws differently from the way they trusted people. A person could fail. A law simply existed, and Andrew preferred it that way. He pulled on his gloves. The latex snapped against his wrist. He checked the left, then the right. He ran his thumb and forefinger along the seams of each glove, checking the fingertips and webbing between the fingers, the wrist, once, again, then a third time. The third was the one that mattered. He could not have explained why. He had been doing it for years. Perhaps there had once been a reason. He had forgotten it. "Ready, Dr. Grant?" Andrew looked up. Scrub nurses was watching him. He nodded. Yes. The room settled. The patient beneath the drape was a 60-year-old man named Robert Chen, retired school teacher, blind for 30 years. Andrew had read the file before entering the room. He had read it twice. 30 years. The number stayed with him longer than he expected, not because it was unusual, because it wasn't. 30 years was a kind of number medicine knew how to contain. It could be entered into a chart, surrounded by dates, and diagnosed and measured, reduced to a line of black type that fit neatly between the margins. Andrew spent most of his adult life turning human suffering into manageable information. Acuity, pressure, damage, risk, probability, outcome. Numbers was merciful. Numbers did not ask anything of you. He stepped closer to the bed. Robert Chen lay beneath the surgical blanket with his hands folded over his stomach. His hair was white at the temples and thinning towards the crown. His face was narrow, the skin around his closed eyes delicate from 3 decades without light. There was something strange about seeing a blind man's eyes beneath the operating lamps. The room was full of light. Robert had none of it. "Mr. Chen. Mr. Chen." The man's head turned towards Andrew's voice. "Doctor." His voice was soft, not weak, just careful. A voice that had spent 30 years learning to navigate rooms without knowing what the faces inside them were doing. "I'm Andrew Grant. I know." A faint smile touched the corners of Robert's mouth. "My daughter told me." Andrew glanced at the chart. She read about the procedure. "She read about you." Andrew looked at him. Robert's smile widened slightly. She said you were the best. Andrew returned his attention to the chart. Your daughter exaggerates. No, Robert said it simply. She doesn't. The anesthesiologist moved towards the bed, checking the lines. Andrew looked down at the man's chart again. How are you feeling? Afraid. Andrew looked up. Most patients said they were afraid. They lied. Robert didn't. That's normal. I know. Robert shifted slightly. Can I ask you something? Of course. If this works, he stopped. Andrew waited. Robert swallowed. He paused again. If you give me my sight back, will I see things the way I remember them? Andrew stared at him. For a moment, the question seemed almost absurd. Then it wasn't. You'll see what's there. Robert returned a smile. Then it changed into something that looked like an apology. That's not quite what I meant. Andrew said nothing. Robert turned his face towards the ceiling. I've been blind a long time. 30 years. Yes? He said the number without bitterness or hesitance, as though 30 years were not something that had happened to him, but somewhere he had lived. My wife tells me the garden has changed. Andrew glanced towards the anesthesiologist. The man was preparing the medication. Robert continued. She says the maple tree by the kitchen window is twice the size it used to be. A small smile appeared. She says the house looks smaller. Andrew looked back at him. I remember that garden, Robert said. I remember the light in the afternoon. I remember the front door. I remember my wife's face. He paused. I remember my daughter when she was 12. Something in Andrew's chest tightened. He ignored it. But all of those things are 30 years old now. Robert continued. He opened his eyes. The pupils did not respond to the light. So when I wake up, he hesitated. What happens to the things I remember? Andrew had no immediate answer. He had answers for almost everything. That was part of the reason why people trusted him. But this question had slipped beyond the boundaries of medicine, beyond the clean territory where certainty lived, and where every molecule could be tested, measured, and restored. It had reached somewhere he did not know how to operate. And certainty was not simply what Andrew believed in. It was the structure on which he had built his life. Memory isn't vision, he said finally. No. Robert turned his face towards him. That's what I'm afraid of. Andrew frowned slightly. Why? The old man's fingers moved against the blanket. Because what if I finally get my sight back? He took a breath. And discover I've been carrying a world that doesn't exist anymore. The room seemed quieter. Andrew looked at Robert. For one brief, inexplicable second, he had the sensation of standing somewhere he had stood before. Not this room, not this hospital, somewhere else. A kitchen, perhaps. A child's voice, a hand reaching for his. The impression vanished before it became an image. Andrew blinked. Robert was still looking towards him. Doctor, yes. When you see something you've forgotten, Robert smiled faintly. Do you know whether you remember it because you saw it? Andrew said nothing. Or because you loved it. The anesthesiologist touched Robert's shoulder. We're going to give you something to relax now. Robert nodded. Andrew looked at him for another moment. Then he said, I'll let you know. Robert's smile deepened. Good. The medication entered the line, and Robert drifted into sleep with the complete, unquestioned surrender of a baby who had finally been given what it wanted. Andrew turned towards the instruments. Scrapple. The instrument was placed into his hand. Everything else disappeared. The first incision was less than a millimeter, a tiny arc at the edge of the cornea. Andrew made it without hesitation. His hand knew exactly how much pressure to use. rooms, exactly where to stop, exactly how far to go. There was no drama in his movement, no pause, no tremble. That's what made it beautiful. The microscope brought the eye into impossible intimacy. The tissue became landscape, vessels became roads, membranes became translucent architecture. Beneath the lens, the small imperfection announced itself. Andrew saw everything. That was his gift. He had always believed that. Not intelligence, not courage, not even skill. Seeing. Seeing was there before anything else could. He worked without speaking. The residents watched from behind. One of them shifted. Another leaned slightly closer. Andrew ignored them. He placed the graph, checked the alignment, adjusted, wait. The room held its breath. Rotated 2 degrees. The resident close to him moved. Not you. The resident froze. Andrew extended his hand. The nurse placed the instrument into it. He corrected the position himself. Now. The resident nodded. Andrew continued. The surgeon's hand was famous. People talked about it, had heard the stories. The hands that never shook. The hands that could repair what other surgeons considered beyond repair. The hands that had restored sight to people who had spent years living inside darkness. Andrew had never liked the praise. It made something uncomfortable move inside him. Because the hands were not the remarkable part. The remarkable part was how little they seemed to belong to him. When he operated, there was no Andrew. There was no sequence. Incision, dissection, placement, suture, check, correct, close. His hands moved with the calm certainty of something that had forgotten how to be afraid. A resident spoke. The graph looked slightly. Andrew didn't look up. Wait. The resident stopped. Andrew adjusted the microscope. There. A small irregularity, almost invisible. He corrected it, then continued. The room exhaled. 20 minutes later, the final suture was complete. Andrew stepped back. Done. The anesthesiologist looked at the monitor. The scrub nurse checked the count. Everything was where it should be. Everything had gone according to plan. The way it always did. Andrew removed his gloves. Left, right, bin, sink, soap, water, dry, door. He left the operating room. The corridor outside was bright. Andrew walked past the nurse's station. Someone greeted him. He nodded. He couldn't remember her name. He had known it once, probably. That was happening more often than lately. Not important things, never anything important. Names, small details, where he had put his keys, where he had already eaten, a conversation he had the previous day, things that belonged to the edge of life rather than the center of it. He had never considered the edges worth worrying about. He passed the waiting room. Families sat in plastic chairs beneath the fluorescent lights. A father held a paper cup between both hands. A woman stared at the floor. A young couple whispered to each other. Andrew kept walking. He had learned not to look too closely into waiting rooms. The people occupying them usually had a particular expression on their face. The expression of hope strained against terror, each one making the other more visible. He had seen it thousands of times in every kind of room, under every kind of light. He had learned that there was a danger in looking in for too long. People didn't want a doctor to recognize their fear. They wanted him to recognize what could be done about it. Anything more intimate could be mistaken for compassion. And compassion, once offered, created an obligation neither of them could afford. Sometimes they thanked you, sometimes they cried, sometimes they held your arm and told you that you had given them their life back. Andrew never knew what to do with that, so he did what he always did. He kept moving. He passed the pediatric wing. His pace changed by less than a second. No one noticed. He noticed. That was enough. The children's drawing on the wall was bright with impossible suns and houses with enormous windows. One showed a family standing beneath a blue sky, 4 figures, father, mother, 2 children. Andrew looked away. He didn't know why. Robert Chen was awake when Andrew returned to recovery. His eyes were still bandaged. His hands were searching the blanket. Mr. Chen, the old man's face turned towards him. Doctor, the surgery went well. Robert let a breath out. It sounded like relief. When? In a few days we'll remove the bandage, and then? Robert hesitated. Hope had done what hope does when held too long, turned quietly into his own kind of preparation. He was no longer waiting to hear the answer. He was already forgiving it for being no. You'll be seen. Try not to take in too much light for the first few days. Robert was quiet. Then his face broke. The crying came without warning. Not the contained tears Andrew had learned to recognize in recovery rooms, but something younger and less defended. His shoulders shook. He covered his mouth with one hand as though embarrassed by the sound coming out. Andrew waited. He had spent years watching people cry after surgery. There was always a moment when the body understood before the mind did. The surgeon could explain the results, the nurse could reassure, the charts could prove it, but none of that mattered when the first tear came. Robert turned his face. My wife is here? Andrew looked through the glass. An elderly woman stood at the other side of the recovering area. Both hands were wrapped around the strap of her handbag. She was crying too, silently. No trembling shoulders, no hand over her mouth, just tears moving down her face that seemed almost surprised to have produced it. Andrew watched her for a moment. 30 years, he thought. 30 years of waiting for this particular door to open. 30 years of learning how to hope without allowing hope to become something that could hurt you. Then the woman looked through the glass. She saw Robert, and for a brief second, before either of them moved, Andrew saw something he had spent his entire career learning to look past. The relief of being recognized, not by a doctor, by someone who had been waiting to be seen. Yes. Robert's face changed. Something in it softened so completely that Andrew had to look away. Good. Robert's hand found his. Andrew hadn't realized the old man had reached for him. Robert held his wrist. His grip was surprisingly strong. Doctor, yes, thank you. Andrew held silent. Robert's thumb moved across the back of his wrist. You know, he stopped. Andrew waited. When you've been blind as long as I have, you forget what you're waiting for. He smiled. Sometimes you think you're waiting to see. A tear slipped beneath the edge of the bandage. But really, he swallowed. You're waiting to find out whether the things you loved are still there. Andrew looked at him. It made him think of what Robert asked him earlier. The question and the promise he had gave before surgery. It triggered something inside of him. Not a memory, not an image, just an ache. Deep, ancient, unexplained. He almost asked Robert what he meant. Instead, he said, rest. He gently removed his wrist from the man's hand, then he walked away. Robert's wife was waiting in the corridor. She stepped towards him. Doctor, Andrew stopped. Yes. Will you be here when they take the bandages off? Andrew looked at her. There was something in her face he recognized. Not the person, the feeling. The terrible faith of someone who has placed something precise into another person's hands. I'll try, he said. Please, she let out. Andrew nodded, then he left. He did not look back. A child was crying outside his office. Andrew stopped. The sound was small, but it caught him. He turned. A boy, 4, maybe 5 years old, in one of the plastic chairs without his feet touching the ground, his face buried in both hands. Beside him lay the stuffed rabbit. One ear was missing. Andrew stood there. The boy's mother was speaking quietly to the nurse. The child didn't hear her. He was too far inside his grief. Andrew looked at the rabbit. Something about it disturbed him. He bent down, picked it up. The fabric was worn soft from years of being held. One ear had been sewn back on a blue thread, badly, a child's repair. Andrew ran his thumb over the stitches. He didn't know why. "Is this yours?" The boy looked up. His face was wet. Andrew held out the rabbit. The boy took it. Their eyes met. For one strange second, Andrew saw himself in the child's face. Not his own face, something else. A recognition without an object. The boy hugged the rabbit to his chest. Andrew straightened. "Thank you," the child's mother said. Andrew nodded. He walked into his office, closed the door, and stood there. He did not turn on the light. He had begun doing that without knowing when he started. The office felt different in the dark. The framed certificates disappeared. The awards became shadows. The photographs on his desk became rectangles of black glass. The room lost its evidence. He preferred it that way. He sat for a while. He did nothing. Then his eyes moved towards the back of the desk, the drawer. He stared at it. He had not opened it in years. He wasn't even sure how many. He knew it was locked. He didn't know why. The distinction should have bothered him. It didn't. Not until now. He pulled the handle. Nothing. He tried again. Locked. Andrew sat back. His heartbeat had changed, only slightly. He looked at the drawer as though it belonged to someone else. Then he opened the top drawer. Pens, paper, a prescription pad, 2 business cards, a receipt, a key. He stopped. The key was small, brass, old-fashioned. He picked it up, turned it between his fingers. He didn't remember seeing it before, yet something in him recognized it, not consciously, physically. His fingers knew the weight, the shape, the tiny ridge along one side. He stood, walked to the locked drawer, inserted the key, turned it. The lock clicked. Andrew stared at the drawer for some time. Then he pulled it. Inside was almost nothing. A photograph, an envelope. The envelope had no address, no name, only 2 words written across the front in his own handwriting. Not yet. Andrew stared at them. He picked up the photograph. It was face down. He turned it over. A child, a boy, 5 years old, perhaps. Dark hair, a yellow raincoat. He was laughing, not smiling, laughing. His whole face had surrendered to him. Andrew looked at the photograph. Something should have happened. Recognition, affection, loss, anything. Nothing did. He looked again. The boy was standing beneath a tree. There was rain on the pavement. A woman's hand was visible at the edge of the frame. Andrew could not see her face. He turned the photograph over. Nothing was written on the back. He turned it face up again. The boy laughed silently at him. Andrew felt the pressure in his chest. He waited. Nothing. He put the photo down. He picked up the envelope. He turned it over. His own handwritings. His own hand. His own words. Not yet. He almost opened it. Then he stopped. He did not know why. Somewhere inside him, something had drew a line. He could not feel it. Not a thought, a boundary. He put the envelope back, closed the drawer, locked it, returned the key to the top drawer. Then he sat down. His hands rested flat on the desk. They were steady. They had always been steady. Those hands had restored sight. They had closed wounds. They had held instruments while other people prayed. They had never trembled when the smallest mistake could change a life. Andrew looked at them now. And for the first time in years, he wondered what they had done when no one was watching. The question stayed. He tried to dismiss it. It remained. He stood and turned on the light. The office returned. Certificates, photographs, wars, the familiar architecture of the life he had built. Everything was exactly where it belonged. Andrew looked towards the photo on his desk. A family photo. He saw Emma's face, Olivia, and his own. He smiled faintly. He knew this photo. He had looked at it 1,000 times. He reached towards it, then stopped. For one inexplicable moment, he could not remember when it had been taken. The feeling passed, or seemed to. He picked up the photo, straightened it, put it back exactly where it had been. Then suddenly his phone rang. Andrew answered. "Dr. Grant," a nurse's voice. "Sorry to bother you. It's fine. There was a call from the donor registry. They have been trying to reach you." Andrew frowned. "About what?" A pause. "I'm not sure. They said it was important." "What do they want?" Another pause. Then, "They said you would know." Andrew looked towards the locked drawer. The photo was still there. The boy in the yellow raincoat. Laughing, Andrew looked away. "Give me the number," he said. The nurse read it out loud. He wrote it down, then she hung up. Andrew remained at his desk. Outside, the hospital continued around him. Doors opened, footsteps passed, machines beeped. Somewhere a child's laugh. Andrew looked at the number he had written. He did not know why the sight of it made him uneasy. He folded the paper once, then again, placed it beside the photo, and returned to work. Because there was always another patient. There was always another eye, another operation, another problem that could be resolved if you was precise enough, if you were disciplined enough, if you kept your hands steady. Andrew Grant had built his entire life around that belief, and for a moment, it was still holding.